I imagine we could continue to talk about taxes. Let's talk about another issue.
Okay.
You have very different views on abortion access, so I'd like to discuss that. Ms. Caraveo, you passed a bill that preserved abortion access in Colorado with no restrictions, even on third trimester abortions. And according to Pew Research, that's not where most Americans are on the issue of abortions. Pew's research said 29% of Americans support abortion without restriction, as Colorado now has. Would you be looking to pass a similar no restrictions on abortion law nationwide?
I think what we need to do in Congress is codify Roe v. Wade. That is a right that has been taken away from women after 50 years. That is what I think we need to do nationally. These are discussions that have to happen between a doctor and a family member and a woman, not something the government needs to be interfering with. My opponent wants to support a national ban on abortion, one that would have no exceptions, even for rape, incest, or the life of the mother. That is something that perhaps she is walking back from now. I trust women. I trust people to make their own medical decisions. I've done that as a doctor. I will continue to do that as a legislator, because this is something where Senator Kirkmeyer does not need to be in your exam room or your bedroom. This is a private decision that needs to happen within a family and with their doctor.
So you said that you would like to see Congress codify Roe. That's different than what Colorado has, which is abortion without restriction. And my question was, would you seek to pass a Colorado-style no restriction on abortion law nationwide?
I would focus on codifying Roe v. Wade, a right that has been taken away from women despite being the law of the land for 50 years.
Ms. Kirkmeyer, you had previously said a couple years ago that you oppose all abortions, no exceptions. You've now said during this race that you support an exception for the life of the mother. So I have two questions around the same issue. Who should determine when the life of the mother is at risk? And should the government be providing any specific support to victims of rape and incest if the government is going to force them to carry their pregnancy to term?
So I think with regard to your first question, who should provide that support or who should make that decision? Again, I think that's through the woman, the mom, and her doctor, looking at it and determining what they need to do. That's what doctors do, that's what moms do, and the patient needs to do. So it needs to be between them. And your second question was?
Second question was, if the government is going to force rape and incest victims to carry their pregnancies to term, should the government be providing any specific support to those women?
Well, so first of all, I would say this. Again, in this state, we have a constitutional requirement that says we don't pay for any public funding of abortions. So I think that would be pretty difficult to be, otherwise we'd be going against the Constitution. But second of all, as a county commissioner, I've actually funded, women's health care is extremely important to me. First of all, I am a woman, I have 2 daughters. But as a county commissioner, I've actually funded the Weld County Health Department, funded health clinics, funded, I'm at the end.
That's okay. I appreciate you both being very careful about the time, but I want to make sure that we're clear on this issue. Your opponent said that you're interested in a national abortion ban. Are you?
I don't believe I've ever stated that, so I'm not sure.
Well, I'm asking you right now.
So at this point, no. I'm looking at, again, I'm pro-life. I've always said I was pro-life. And I have, and it's been more than just a couple of years. I looked at it, and my position did evolve to that the life of the mother, it makes sense. I guess just in my mind, if the mother passes, obviously the child inside of her is going to pass as well. So we need to make that exception.
No, please go
on. With regard, again, could you tell me the question again? I'm sorry.
No, I wanted clarity on the national abortion ban.
I'm going to support whatever saves lives. It's not an all or nothing thing to me. If there's a way to save some lives, I'm going to work to save some lives.
Okay. You want a final thought before we moved on?
Yes, I think it's important to note that she said at this point. Now that she is running for a general election, suddenly she is trying to moderate her position. She said in 2014, I do not support any exceptions to abortions. She said in 2020 that she was 100% pro-life, no exceptions. Suddenly, when we're in the middle of a general election, perhaps she's trying to moderate and hide her views from Coloradans. But I think it is important to note what the history is here, and that as a commissioner, she has not supported women's reproductive rights. She actually voted as a commissioner to ban Plan B from Weld County clinics. She has not supported women's reproductive rights, whether it has to do with contraception or with abortion, but she's trying to moderate her position now.
She's saying that her view changed on something. You don't believe that it's genuine?
I don't believe that it is. I think that we have many statements in the past of her saying that she does not support any exceptions to rape. Now any exceptions to abortion, even in the cases of rape or incest. Now she's saying that it's up to the mother. She wants to take that away with the national abortion ban, which importantly would ban abortion in Colorado.
A final thought before we move on.
Again, I haven't ever said that I was in support of a national ban. Second of all, That was 8 years ago when I made that statement. I'm not even sure if there was anything further with the clip, but I do know that over the course of the last 8 years and really examining this, and when I was a Weld County Commissioner looking at it, I did change my position or add it to my position. It evolved. And looking at it in the life of the mother is extremely important. With regard to what I've funded at the Weld County Health Department, I've funded programs that basically the Nurse-Family Partnership, which brings a nurse in with low-income first-time moms through their pregnancy and for up to 2 years afterwards so that they have that resource with them. Funded things like breast and cervical cancer screenings, funded the health clinic, funded all sorts of programs that are for women's health. I've actually funded that and fought for those programs.
Ms. Kirkmeyer, thank you.